listening to a podcast from Lite FM.
The Light Breakfast with Terry and you. Good morning. It's our HealthWise special today, and we are talking about the newly available dengue vaccine with our guest who's been here before, of course. We rely on her to find out more things and make things more plain when it comes to medical-related topics. Dr. Rakhee Yadav, consultant pediatrician. Thank you for joining us, Dr. Rakhee.
Thanks for inviting me, Terry.
And I'm ready to learn so much from you because there are so many questions swirling around the newly available dengue vaccine, the TAC 003. It's the first to be launched in Malaysia, and dengue has been a big issue in Malaysia for decades. We've seen the ads telling us how to make sure the mosquitoes don't breed. Why is this vaccine only coming in now?
Well, there are so many dengue cases previously, and in fact, there's a global rise in the incidences of dengue cases worldwide, right? In fact, it affects more than 100 countries, and it's a significant global threat.
Right.
And in fact, according to WHO, the number of dengue cases has actually risen from 500,000 in the year 2000
Wow.
to 5.2 million in 2019.
Wow.
Right? And Asia accounts for 70% of that burden.
Right.
In Malaysia alone, the dengue cases have increased significantly with 120,000 plus cases reported last year,
Right.
with marking an 86% rise compared to the previous year.
Right. That's huge.
And
A leap.
dengue-related deaths have increased by 78%, with the highest concentration in Selangor, so where we
Wow.
stay. Right?
Right.
In the first quarter of 2024 itself, there was already more than 40,000 cases reported and almost 30 deaths attributed to dengue fever complications. So this shows a global rise overall trend. And there have been many vaccines that have been in the trial process and they've been trying to get it out there, but none of them have actually been in the post-market. So which means we have not had a vaccine proper out in public at the moment. So besides the previous vaccine, which was released worldwide in a few countries and are actually still being used, the current dengue vaccine in Malaysia is the first and only approved dengue vaccine available for our population.
Right. So in a way, we should be grateful that it's taken this long because it means that it's been tested and trialed longer as well.
Yes.
Tell us more about the vaccine itself, the dengue vaccine itself. How does it work? Yeah.
So it's a live attenuated vaccine. It is given via an injection subcutaneously, right? So it's usually on the arms for
the regular
adults,
way that
the
most
regular
of us
way
get it.
most of us get it, or sometimes in thighs in the children. So it's given as a 2-dose series, which means the first dose is given after 3 months. The second dose is given, and you must complete 2 doses to get the full protection.
Okay.
All right. So that's all about the vaccine that we know.
After the second dose, do I need to get a booster later on in life?
So good question. So this trial that we actually had to study this vaccine ran over 4.5 years.
Right.
And at that point, there was no necessity for a booster. So what they did is they extended the trial for another 2 years.
Right.
And that results is coming out sometime this year, maybe early next year. But looking at the first trial results itself, it doesn't show that this is any waning of antibodies. Like if you all remember COVID correctly, I'm sure everybody was following the medical scene during the COVID period. We all looked at the waxing and waning of the antibodies, and we realized that the COVID vaccines, the antibodies dropped tremendously after a year. So that's not the same that we're seeing with this dengue vaccine, where it sort of plateaus and it maintains. It does drop a little bit, but it sort of maintains after a while. So we're not looking at a booster at the moment, maybe for a certain group population, but not for the general population as is.
Okay, and what about who can get the vaccine? Is there an age limit?
So Malaysia has approved this vaccine for those who are 4 years old and above, which means children and adults as well as the elderly, right? Because we noticed that the number of cases, dengue doesn't discriminate. It affects everybody. So we also want to protect our children, ourselves, and as well as our parents. So it's a good thing that this vaccine is available for 4 years and above. There's no difference in dose between children and adults or elderly, and it's the same way that it's given, injection for both populations.
Right. And I'm going to ask the very Asian question now, Dr. Rakhee. The super Asian question that my parents would definitely want me to ask as well.
Okay.
Will it be accessible in terms of affordability? Basically, how much is it lah? Yeah.
So it's not as expensive as some of the vaccines that have come out in the market recently. But of course, this vaccine is not available in the National Immunization Program and is not given free at the moment by our government.
Right.
So this is available only in private healthcare facilities, which means private hospitals or certain private clinics.
Right.
So we have to remember that all these places have got their different overheads. So the price ballpark figure would be definitely above 200 per dose.
Right.
But the exact price, I would say, discuss with your doctors and whichever hospital or healthcare facility you're going to get. Because with the 2-dose series, we want people to get 2 doses.
Right.
So there'll be a lot of package deals coming out. As with
Right.
Malaysians, we always want to know.
We want to know.
Got discount not, you know? Right, not. So
You know so well. Absolutely. And of course, the next question people want to know, of course, including myself, are what are the known side effects? We'll get into that as we find out more about the newly available dengue vaccine in our Healthwise special today with Dr. Rakhee Yadav here on the Lite Breakfast.
Lite FM, all-time favorites.
The Light Breakfast with Terry and you. Good morning. And today it's our Healthwise special talking about that newly available dengue vaccine. Many of us are considering whether we should get it or not. And we have with us a person who's shedding light on this, consultant pediatrician, Dr. Rakhee Yadav. Thank you again, doctor, for joining us. Always great having you here with us.
thank you, Terry.
Also just found out you don't drink coffee. You're so much better than me. Okay, now let's find out about the efficacy about the vaccine. Let's say I get the vaccine, both doses that are required of this dengue vaccine, what are my chances of still getting dengue?
All right, so let me just put it out here very clearly. There's no silver bullet. There's no single method to prevent dengue, right? So dengue vaccine should be part of a holistic approach when we want to think about prevention of dengue, right? So we still have to continue with the same other methods, reducing our exposure during the peak mosquito biting periods, between 5 dawn and dusk, between 5 to 7 in the morning and evening. Wear long sleeves when you're going out. Use mosquito repellents and things like that. And there's also a Wolbachia program in Malaysia where there's a certain bacteria in the mosquitoes that inhibit the transmission of dengue.
Yep.
So this is also all other programs that are available besides the dengue vaccine.
Right.
So when we talk about the dengue vaccine, we have to understand that the current dengue vaccine available in the country has actually been approved since February this year for 4 years and above, as I mentioned. And this
For 4-year-olds and
for
above.
4-year-olds and above,
Yep.
right? And this is not the same as the previous dengue vaccine, right? So our current DCA or Drug Control Authority has actually given a conditional registration for the vaccine, which basically means the vaccine has been approved with 2 conditions, right? And these 2 conditions, the first one is we have a national registry to provide ongoing monitoring data, right, for the vaccine safety and things like that, to facilitate tracking of the vaccine for all those who've received the vaccine. Okay, so that national registry is basically for us to know who has gotten a vaccine and who hasn't,
So
which
everyone
locality
knows,
and things. So everybody
and
knows.
you can track
and
as
we can
well.
track. Yeah. So that's what the national registry is all about. Nobody's trying to get your data. So
Right.
the only thing that we will get is basically your name and and which vaccine was given to you.
Right. Part of our health history. lah.
Yes, correct. Like how the COVID data was collected
Yeah.
as well. So the second condition is basically they have an ongoing surveillance. So this is not compulsory. This is actually a voluntary surveillance. So after you get the vaccine, you can opt to be in the ongoing surveillance where you'll get a call 4 times, 2 times after the first dose and 2 times after the second dose, where they basically find out, did you have any symptoms? Are there any adverse effects that you had with the vaccine? So it's basically for us to monitor the safety and the side effects of the vaccine in a Malaysian population, right? Because we also want to know what's happening in the post-market release of this vaccine for our Malaysian population. We estimate it'll be the same as other countries because Indonesia has already started this more than 2 years back.
Right.
So they already started their surveillance. So that's what we mean by conditional registry, right? And with regards to how well this vaccine works, we have to remember that this trial was done in more than 20,000 people, right? And more than 8 countries, I think, all over, which is endemic and non-endemic countries. That means those countries that had a lot of dengue fever and those who didn't have a lot of dengue fever. And the efficacy of the vaccine is 80.2% against symptomatic dengue in a year.
Wow. So that means a person who does get dengue will still, or does that
it
avoid
prevents
it?
you. So 80% prevention. So it
Oh, so
basically
you don't
means
even get it.
yeah.
Yeah.
So only 10% chance of you getting it, severe dengue, symptomatic dengue, if you get the vaccine.
Right.
Let's put it
right.
this way. So you only have a 10% chance or less if you actually get the vaccine. So that
Wow.
reduces your risk of getting symptomatic dengue.
Right.
So we don't take MC unnecessarily, lah, right? And the other second endpoint for the trial is basically it prevents 90.4% hospitalizations at 18 months after vaccination. So which means less than 10% of those who do get dengue will be hospitalized. Right? So we
it's
have
that
to
one
remember
more wall of protection that
exactly
along with all the other measures that we should take to avoid getting bitten in the first place, perhaps, or exposing ourselves to a situation where we could get dengue. This is just one more shield that is up first.
So same like COVID, we still say wear your mask, wash your hands. So same thing with the dengue vaccine. We still want you to keep your surroundings clean. We still want you to avoid peak biting periods. Same thing. So there's a holistic
is not your
approach.
Free pass.
Yeah, this is not your free pass.
Walk out into the open and go, bite me, mosquitoes.
Yes.
Okay, got it.
No 100% protection. And one more thing to add is we also want to know at the end of that trial of 4.5 years, what was the overall protection? Did it drop? Right? So remember I said 80% for symptomatic dengue and 90% for hospitalization. So that number drops slightly to 84.1% and 61.2%, right? So from 90 it dropped to 84 and from 80 it dropped to 61. So it's still a good number. Everything above 50% is something that we're quite happy about. So it's still a good number after almost 5 years, right? But we're eagerly awaiting the trials, the booster trial results to come out, and then we'll know, do we need to take the vaccine maybe 10 years later, 5 years later, or see how it goes, or it doesn't, it just plateaus at this number, and 2 doses are enough already.
And those results will be coming out very soon.
In the next one year, 2 years around there.
Okay, all right.
Yep.
And next will be what I wanted to ask you earlier, actually, which is the side effects. We'll get into that next here as we discuss the dengue vaccine newly available here, our Healthwise special happening with Dr. Rakhee Yadav, consultant pediatrician, here on The Lite Breakfast.
Lite FM, all-time favorites.
The Lite Breakfast with Terry and you. Good morning. This is our Healthwise special talking about and finding out more about the newly available dengue vaccine with Dr. Rakhee Yadav, consultant pediatrician, joining us again. We've had you here so many times. You appreciate your insight into all things medical related.
It's good to be back, Terry.
Now, we're going to ask you one thing about this that is on a lot of people's minds as well, which is whenever we talk about vaccines, including this one, what are the possible side effects? We hear about it always having a range, right? Depends on people as well. But what are the known side effects?
All right. So as typically expected with any live attenuated vaccine, the most frequently reported side effects were basically just pain, redness over the site of injection. Sometimes you have a bit of tiredness, as with any other vaccine you get. So tiredness, muscle aches, a bit of headache, and sometimes fever in the first couple of days. But do note that the side effects actually reduce in the second dose compared to the first dose. Right? But just to reassure everybody that WHO actually recommends taking the dengue vaccine in a public immunization program in countries where high transmission intensity of dengue poses a significant public health, which means Malaysia. That basically spelled out Malaysia to us. And it's also part of the WHO's list of pre-qualified vaccines, which basically reinforces its quality and suitability for use in a public vaccination program. So while we're waiting for the government to decide all of this, it is still available in our private sector. But do take note as well that is approved in more than 30 countries worldwide. In fact, Brazil, just past 1-2 years, has put it into their national immunization program already. So we're looking at not just a new vaccine, it has already been launched almost worldwide in more than 30 countries. So it's safe that I would say anybody 4 years and above as what is recommended to take the vaccine.
So that's actually going to definitely set people's minds at ease when it comes to trying to make that final decision, which of course ultimately is still up to you. It is your choice whether or not you want to take this dengue vaccine and have it administered or not, keeping in mind all the information that Dr. Rakhee has been sharing here with us as well. Speaking of those side effects, will they be difficult enough or rough enough for people to ask for an MC possibly? I know people are asking. You're thinking
really
it already.
Need an MC. I was just talking to Keith about this just now. If you really need an MC, you can take an MC on the day you get the vaccine or maybe the next day. But like I told him, I said when I got the COVID vaccine, it was in between work. It was back to work. I got the flu shots in between my clinics. So I get my vaccines in between work.
We're not all as strong as you, Dr. Rakhee. We're not all as strong as you. Also, of course, I'm always reminded of of the dengue vaccine, every time I smell the fogging that goes around in the neighborhood, because when you smell the fogging, in most cases, it's because either someone has already contracted it, or it's because the mosquito has been spotted, and so people are trying to take precautionary measures as well.
There's a difference between the fogging by the Ministry of Health and the fogging that has been paid. So most high-rise buildings will have fogging every month, every few weeks, right? So that's not because you had dengue. That's a precautionary measure.
Yep.
But if you see the Ministry of Health's vehicle coming in your area and fogging, you know that there has been a dengue in your area within the past 1-2 weeks.
Right. So every time you smell that smell, look for the Ministry of Health vehicle to see which kind of fogging is going on. We are talking to Dr. Rakhee Yadav here, consultant pediatrician, about the newly available dengue vaccine here on the Healthwise special on the Lite Breakfast.
Lite FM, all-time favorites.
The Lite Breakfast with Terry and you. Good morning. It's something that's been discussed in many Mamat sessions. The brand new dengue vaccine that's been made available here in Malaysia. It's our Healthwise special about it with Dr. Rakhee Yadav with us, consultant pediatrician. Love having you here with us to make things plain and simple for my mind also, so that I can understand it better. Now, Dr. Rakhee, when you go looking for information online, as we mostly do, right, to find out more about the dengue vaccine, another piece of information pops up in that search, which is a dengue vaccine, another one, not the one available here, called Dengvaxia, which was previously launched in 2016 in countries like the Philippines. And in 2017, however, it backfired when about thousands of Filipino children who received that first dose of that other vaccine reported an increased risk of developing severe dengue. So this knowledge of this other vaccine may be one of the reasons why people are apprehensive about this vaccine that's available here in Malaysia. So what would you say to people who are considering it in light of that information?
Right. I love that you brought that up, because there is a huge difference between that vaccine and the vaccine that has been approved in Malaysia.
Right.
All right. There are so many actually, but one of the two major differences is the previous vaccine can only be given to those who've had dengue before.
Right.
Right. So there's only a specific population of people who can get that vaccine.
Right.
Whereas our vaccine, the one that can be given in Malaysia, the one that has been approved in Malaysia, can be given irrespective of your baseline status, which means whether or not you've had dengue or not, you don't need to pre-test yourself. Hey, did I have dengue before? Otherwise, I worry can get dengue or not.
That's a huge difference.
Huge difference, because we also don't want to have any other side effects from that. So regardless of your baseline status, and we know in Malaysia, everybody anywhere, even if you're driving in your car right now and you're thinking, I know someone who's had dengue before, if not yourself.
Right.
That's what we're facing in Malaysia.
Yeah, true.
Right? So we worry as well if it's something that is only for a certain population. So that's one of the biggest difference. This vaccine can be given irrespective of whether you've had dengue or not. The second big difference is, why is this available for both, right? Is because the backbone of the vaccine is totally different from the previous vaccine. The previous vaccine was on the yellow fever virus backbone, whereas this current vaccine is on the live attenuated dengue serotype 2 virus. Did you know, Terry, there are 4 types of dengue? Yes. So Den 1, 2, 3, and 4.
Right.
So Den 2 is considered one of the most severe dengue type serotypes.
Wow.
So this particular vaccine is based on that backbone. So we know that this provides a genetic backbone for the vaccine, and it's designed, right, so that it can protect against all 4 dengue virus serotypes.
Right.
These two are one of the major differences between the previous vaccine and the current vaccine, besides the fact that WHO was very, very, very strict about its regulations and how a trial was conducted post the first vaccine being released into the market. Of course, nobody wants a vaccine that would harm anybody, right? So because of that incident, there were a lot of rules and regulations by WHO in how to conduct a trial.
Right.
And this particular vaccine followed those rules and regulations to each point.
Which is also the only vaccine that's been approved and made available in Malaysia. Right now. So that at least sets my mind at ease, considering all that information. And finally, Dr. Rakhee, if you're speaking to someone right now who is still on the fence, trying to figure out whether or not they should get this newly available dengue vaccine in Malaysia, what would you tell that person?
So for everyone out there on the fence, I would say look around. If you know someone, if you've had dengue, if you're worried about complications of dengue, and looking at the global rise in the number of dengue, I think it's just it will help you rather than you just protecting yourself with mosquito repellent. There's only so much a patch on your t-shirt can do for your kids and for yourself, so get the vaccine, not because it's not going to 100% protect you, but get the vaccine because it's going to add into the armor of prevention of dengue as a whole for yourself.
Right. So with all that information, ultimately you decide on your own whether or not you want to get this vaccine for yourself. Dr. Rakhee, thank you so much for joining us and enlightening us on all the various aspects and information of this new dengue vaccine available in Malaysia, and the only one that is available, in fact, here on our special Healthwise.